I'm Tim Wilson. I'm a urologic oncologist, and I'm chair of urology at the St. John's Cancer Institute in Santa Monica. I've been here since 2015. We have a fellowship in urologic oncology that is either 1 or 2 years. Our fellows come from accredited programs in the United States. Most commonly, we have 1-year fellows that come, and they are here to learn more about urologic cancer work and, of course, robotic surgery. They expect to work side by side with me in the clinic and in the operating room. I operate about 3 days a week, and we're in clinic a couple of days a week. They also will work and be in the operating room with Dr. Jennifer Linehan. Dr. Linehan does primarily upper tract disease, kidney cancer, and urinary reconstruction. I primarily do urinary bladder cancer, robotic cystectomies, and radical prostatectomies, robotically, of course. The fellows also have the opportunity to work alongside Dr. Dave Hoon in his laboratory. He's got roughly 35 years of continuous federal funding and has run several program projects. He has trained many academic fellows from around the world, and the fellow has the opportunity to work alongside him doing translational research. We also have a growing program in outcomes research. So we have a data manager, we have nurse practitioners, PAs that work alongside the fellow, and the fellow has the opportunity to review databases, write papers, present at meetings, and work alongside us as a colleague, learning more and more about urologic cancer work. So we have recently expanded our fellowship in urologic oncology. Dr. Linehan and I continue to work here at Providence St. John's Health Center and at the Cancer Institute, along with Dr. Twardowski. Dr. Twardowski is a medical oncologist that joined me here from City of Hope, and he specializes in urological cancers. We work as a team, as a group with him. We've just added Dr. Ram Narayanan, who was a former fellow of ours, and as a result, because our program is growing, we're expanding our fellowship.
Hi, my name is Ramkishen Narayanan. I graduated from the Urologic Oncology Fellowship in 2019. I was a 2-year fellow, and now I work at Providence St. Joseph, affiliated with the Disney Family Cancer Center, and I also will be an assistant professor here at the St. John's Cancer Institute. My residency program did not have a research year, so when I was looking for the Urologic Oncology Fellowships, I wanted something that would give me a 2-year fellowship, at the same time give me an opportunity to be in an area of the country that I had never been to before. And so my mentors asked me to come and take a look at the St. John's Cancer Institute. At that time, it was the John Wayne Cancer Institute. And I was very impressed by their research opportunities, as well as the clinical robotics opportunity with working with Dr. Tim Wilson. In my research year, they had a very targeted plan to look at lymph node metastases from prostate and bladder cancer. My research involved looking at the sentinel lymph node concept to try to get a novel technique to do pelvic lymph node dissection and understand pelvic lymph node metastases for prostate cancer. So my PI was Dr. Tim Wilson, but the real gem of an opportunity here was the next generation sequencing with the lab of Dr. Dave Hoon, who's internationally known for several for his translational research, and that's what I was involved in. I published a large review on the sentinel lymph node concept, and I ended up reviewing so many articles that I became a national expert on lymph node metastases in prostate and bladder cancer. We also set up a translational project looking at how these lymph node metastases can be identified based off of the lesion and the MRI from the prostate cancer itself. So that work is still ongoing today, so it's nice for me to come back and look at that research and continue to carry that on. My clinical year was fantastic. Dr. Wilson is a nationally recognized and master robotic surgeon, so that part of my fellowship was phenomenal in every way. And the skills I learned from him, even just the movement on the robot, and of course the novel techniques that he's performed for treating prostate cancer in the radical prostatectomy, I still kept those techniques in attending practice. Of course, you modify as you go along to your personal idiosyncrasies, which I've certainly done, but several of those key core principles that he taught me, I've maintained, and even as recently as several months ago, there's techniques that I've passed on to trainees that I've worked with, and they've definitely been very impressed. My year, I ended up with about 150 robotic prostatectomies. At that time, the fellowship was certainly weighted on percentage, close to 75% prostate, and then 25% all other urologic oncology pathology. That, I believe, now is increasing because of just how busy everybody's gotten. Dr. Linehan, with her expertise in kidney cancer, and both Dr. Linehan and Dr. Wilson work together for the cystectomies. So I think now, with how the fellowship is really blossomed, and even from talking to the current fellows, I think it's really going in a positive direction. And with me getting involved at Burbank, we're hopefully going to develop that site as another rotation site for the fellows to come through and expand their volume even more. One of the gems of the St. John's Cancer Institute here is that there's also the Complex Surgical Oncology Fellowship. So a lot of my good friends to this day were fellows from that fellowship. And in training here, you will get involved in multidisciplinary cases, and that's a great learning experience. So I definitely still, to this day, remember a case I did with Dr. Foshag and one of my contemporary surgical oncology fellows involving a big pelvic mass, and from urology we helped sort of reconstruct the bladder. But that kind of thing happens here frequently, and it's a great learning experience. Because I trained on the East Coast, coming to a fellowship here in Santa Monica, it's a once-in-a-lifetime experience, and I highly recommend all of us, after we finish training and go on to practice, there'll be certain moments in your career where you'll really be so happy that you did certain things. So here, coming and training in Santa Monica, there's no other fellowship that will offer that. So you will be very, very fortunate to come here and train, and you'll make a great decision. Every day we would go out to the pier and we would enjoy these small moments when you're so busy and training. But for the family, it's a fantastic place to have that fun time and fellowship. So you can do everything here. There's the beach, there's hiking, shopping. There's nothing you can't do here in Santa Monica, and you'll have a great time. Well, one, thanks for hiring me back. And no, I think the biggest thing that I can tell Dr. Wilson and Dr. Linehan, Dr. Twardowski, is that in your urologic career path, the biggest thing that will stick with you are the people you train under and their demeanor and how they make you feel supported. So here, during fellowship, it was my favorite time in all of my urologic training. So to them, I say thank you for giving me such a wonderful time in my training. And now my chance is to pay it forward to develop the program at the Disney Family Cancer Center and pay it forward for not only the community, but certainly the fellowship.
Well, I'm Dr. Philip Hsiao. I'm the one-year clinical fellow here at St. John's Cancer Institute in the Urologic Oncology Fellowship. The clinical year consists of essentially operating and being in the clinic specifically to see more complex urologic oncologic cases. I'll be graduating in 2023, and I'll be heading back up to Northern California to UC Davis. Specifically, we focus on kidney cancer, prostate cancer, bladder cancer, and the volumes is mostly prostate cancer. We do about 150 to 200 robotic prostatectomies a year with complex, partial nephrectomies as well, which number up to about 50, and as well as purely robotic cystoprostatectomies with various intracorporeal diversions as well. So these guys are at the cutting edge of what can be done minimally invasive in urology. I actually heard about this program from my co-resident who wanted to come to this program the year before me, but an opening wasn't available to him. Additionally, Dr. Tim Wilson, he is one of the forefathers of robotic surgery in the United States, and having the opportunity to work with him, given that not only is he a well-regarded and well-known surgeon, but also his reputation of being extremely patient and benign, it's really been a pleasure to be able to work with him. The main reason to come here is to essentially get better at robotic surgery, which has become standard of care now in urologic oncology, which may be a little deficient in some residencies, and also to have the autonomy to really learn all of the little surgical techniques and to really get the volume in. And so having so many robotic prostatectomies and partial nephrectomies, I think they're doing a very good job preparing me for being able to do this on my own in just 5 months. Here as the clinical fellow, we run the Prostate Cancer Multidisciplinary Conference, which is twice a month. We are also part of the General Genitourinary Tumor Board run by Dr. Twardowski, who we work very closely with in medical oncology. It's an extremely important thing to be able to talk and be very friendly with all of the specialists who work with the same disease. So you get multiple different approaches on how to treat, for example, prostate cancer or bladder cancer, and have them, work in the same room, being able to just sort of casually ask them a question or come up with complicated, treatment plans, I think is number one, best for the patient, but number two, also extremely great for learning. So you never feel like you're in a rut. You will always be able to keep learning with all these people right there. And it's a very collegial atmosphere as well. So that's been also a highlight of this experience. The most difficult case would probably be anywhere the cystoprostatectomies and intracorporeal neobladders, which we do here. Number one, long surgery. Number two, as we all know, the patients can stay in the hospital for a bit longer. To be able to see that done minimally invasively, to see the positive outcomes from that, it's just good to see something different than from where I trained. We do work with very closely with the Surgical Oncology Fellowship and their surgeons as well, especially when there needs to be a combination case for a large pelvic cancer where the bladder needs to be removed, urinary diversion needs to be done along with all the other bowel malignancy surgeries. So in terms of extirpative surgery or big exenerations, we are a big part of, and we do those robotically as well as open. So I would say maybe we do 20 or 30 joint cases with the surgical oncologists to really get that open oncology experience. It's definitely interesting to work with them to see how different they approach things. It's also a great chance to meet with the surgical oncology fellows as well, and it's nice to have sort of the camaraderie there to talk to them and sort of talk about fellowship, and we're in the similar stages of life, so that's another unexpected bonus. Working in Santa Monica is like a vacation every day. I sometimes don't believe I'm actually working here, and everybody's jealous when I say I do, just because I can walk to the beach anytime. It's basically sunny 300 days of the year. It's not too hot, it's not too cold. This is like my vacation here, even though it's more training, and I'm very, very happy about that. I think you should definitely come in with an open mind, because the way they do surgeries here, quite a bit different, I think, than how most academic programs would do it. However, I think it's really important to sort of broaden your horizon and to sort of absorb the different techniques Dr. Wilson has. And also Dr. Linehan, who is an extremely good teacher, very patient, will let you, you sort of fly immediately on your own. And secondly, just get used to Dr. Wilson's jokes, because they're the same 15 over and over again.
I'm Josh Gottlieb. I'm in the St. John's Urologic Oncology and Robotics Fellowship, and I'm in the 2-year fellowship, where my first year right now is in research, and then the second year will be in clinical, where I'm operating and seeing patients in the clinic. And so I really was interested in this program because the Cancer Institute here has access to a whole bunch of translational and molecular biology research, and we do a ton of single-cell sequencing on tissue, blood, urine, which has led to countless publications from Dr. Hoon and his team in the lab, as well as us. And so the majority of our projects are on renal cell carcinoma and prostate cancer, using the single cell sequencing for liquid biomarkers. And we've also been able to present this at conferences and abstracts. And then we've also already had about 4 to 5 publications just in the first half of this year already. And so we're very productive. I'm working on a handful of different projects. As far as the lab goes, we are still working on looking for biomarkers in renal cell carcinoma, and that is where we're using our tissue and blood and urine specimens from Dr. Linehan's kidney cases, and we're hoping to have a manuscript out by the end of this month. I'm also working on a few other database projects where we are looking at Dr. Wilson's prostatectomy patients, and we're focusing on patients who have had lymph node positive disease and looking for any predictors in regards to recurrence-free survival. And so we've already had this presented at some conferences, and we're hoping to also have this manuscript done soon. I actually was pretty passionate about research, and I think that in the small urologic oncology world, aside from just being able to contribute to the literature and utilize this great lab that we have here, it's also been a great experience for networking, because when we are going to conferences and getting our research out there, you're meeting a bunch of leaders in the field. And especially for me wanting to stay in Southern California, I thought that was just a great opportunity. I think one of the great things about this research fellowship, as well as it gives us a lot of autonomy to run the projects on our own. As far as, nobody's really micromanaging me. I'm in charge of just either getting clinical trials up and running and making sure that we're working with all departments in the research lab as well as on the clinical side to coordinate all of that care. And then in the database research, this is really on my time, and I'm able to get through the project as I see fit. One of the great things about this program is we're also involved in clinical trials, and the HiMaCheck trial is really to do with a special probe that is inserted into patients' veins in order to detect cancer cells. And so this has been actually developed by Dr. Hoon's lab, and so we have been recently just getting up and running with this trial. And so I'm coordinating between the research teams, the clinical side, as well as all of the research team in the lab, making sure that everything runs smoothly, all protocols are being followed appropriately. And it's pretty exciting. So we're excited to see what we find at the end of this trial. So the nice part is that we have pretty quick progress on this, and then we'll run the analysis and hopefully get a manuscript out before the end of the year. So after my first year in research, then my second year will be fully clinical, where I'll be operating, seeing patients in the clinic. But the fact that I've had a whole year of research to get up and running, I'm sure some of those projects will carry on with me into my clinical year, although that won't be my only focus. So I still expect to have more research involvement throughout that year, as well as more publications. The highest volume that we do here is robotic prostatectomies with Dr. Wilson, and he has really great techniques that have led to great outcomes with his patients, and so that is one of the novelties about being at this program, is learning his technique. In addition to that, we have a lot of partial nephrectomies and radical nephrectomies with Dr. Linehan. She tends to do the majority of the kidney cases, and then they will team up and we'll do cystectomies with the two of them. So we have really great volume for bread and butter oncology cases, and so that's what I was really hoping to focus on in my practice, was prostatectomies and kidneys. And so I think we have a great opportunity for that here. I was looking at robotics and oncology fellowships in the Southern California region, and this was one of the first ones that really popped up on my radar, aside from, again, being in just this great location. And then I actually spoke to one of their prior fellows, who was a friend of my prior attendee. And everybody I've spoken to from this fellowship has only been raving about it. They said that it's just a great environment with great mentors. There's no bad attitudes that you're working with here, and the volume is great, and your autonomy is also great. And one of the issues with fellowship is you don't always get to do as much as you might expect, but here we have great autonomy under guidance, of course, with Dr. Wilson and Linehan. So we are in tumor board usually twice a month, and we also have a prostate cancer specific tumor board also twice a month. So the prostate cancer conference is led by the clinical fellow, and then the overall GU tumor board is led by one of our medical oncologists, Dr. Twardowski. I think Dr. Wilson has a very, effective way of training us, through a stepwise and gradual process. And so this is a very structured style to learn, and it's really fantastic. And then Dr. Linehan also provides kind of a different style where she'll really let us go as long as we're, progressing, and, we still have plenty of autonomy to get through the majority of cases as long as we're comfortable and everything is going safe. I mean, and one of the great things that we're all very confident from this program is we'll come out very comfortable performing prostatectomies and kidney cases. If you did a 2-year fellowship that has this research year, it really does open doors for academic jobs in the future. And so I didn't know for sure if I was going to go into private practice or at an academic institution. So I was really happy that this is keeping all of those doors open for me. And in addition, it's really kept me up to date with all of the cutting edge research. And so I'm so much more integrated into the research coming out than I was in residency. And so I'm hoping to stay in Southern California, and I'm excited to see where it takes me.
Our fellowship is not an SUO fellowship, and most of the people that applied want to do a 1-year clinical fellowship, which is what we're primarily offering. So those fellows that are doing a 1-year clinical fellowship are here to learn more about surgical management and medical management of urologic cancers and robotic surgery. I'm currently doing about 100 to 150 radical prostatectomies per year. Dr. Linehan does primarily upper tract disease and retroperitoneal disease and is doing about 50 to 75 kidneys per year. We do about 10 to 20 robotic cystectomies per year. We also run a multidisciplinary prostate cancer conference, a multidisciplinary conference looking at MRIs primarily, with the pathologist, with the imaging experts, and with radiation oncologists and other experts and interested folks from around the city. To apply for our fellowship in urologic oncology, fellows should be thinking about it in their residency when they are PGY 3s or 4s, and apply then or contact us then. Please look at our website. We're happy to speak with you by telephone or, of course, meet you in person at a meeting or here out in Santa Monica.